Every second counts after a critical injury. Swift action by first responders can be the difference between life and death. It's during this golden hour that proper first aid can stabilize a patient and improve their chances of survival. This guide provides a step-by-step approach to managing critical injuries, focusing on assessment, vital signs, and essential care. Remember, this information is for educational purposes and should not replace professional medical training. The first step in any emergency is to ensure the scene is safe. Once safety is established, the primary survey begins, following the ABCDE protocol airway. Check if the airway is open and clear. If the patient is unconscious, open the airway using a head tilt chin lift maneuver. Breathing. Look, listen, and feel for breathing. If absent, start rescue breathing immediately. If breathing is present but labored, provide supplemental oxygen. Circulation. Check for a pulse. If absent, begin CPR. Control any major bleeding with direct pressure. Disability. Assess the patient's level of consciousness using the AVPU scale. Alert, voice, pain, unresponsive. Check for any obvious neurological deficits. Exposure. Expose the patient's chest to check for breathing and circulation. However, be mindful of the environment and prevent hypothermia. Once the primary survey is complete, a more detailed head-to-toe examination, called the secondary survey, is performed. Head injury. Check for any deformities, bleeding, or bruising. Assess for signs of concussion, such as confusion or loss of consciousness. Femur fracture. Look for swelling, deformity, or tenderness in the thigh area. A femur fracture can cause significant blood loss, so controlling bleeding is crucial. Abnormal mouth sounds. Gurgling, snoring, or stridor, high-pitched breathing, can indicate airway obstruction. Immediate intervention is necessary to secure the airway. Throughout the assessment and treatment, continuously monitor vital signs. Pulse. Assess the rate, rhythm, and strength of the pulse. Blood pressure. A drop in blood pressure can indicate shock. Respiratory rate. Count the number of breaths per minute. Oxygen saturation. Use a pulse oximeter to measure the oxygen level in the blood. Temperature monitor for fever or hypothermia. Management strategies for critical injuries include airway management. Maintain a clear airway using techniques like jaw thrust or airway adjuncts. Breathing support. Provide supplemental oxygen or assist ventilations as needed. Circulation, support, control bleeding, administer IV fluids, and consider medications to manage blood pressure. Pain management. Use appropriate pain relief measures to minimize discomfort. Immobilization. Stabilize fractures and suspected spinal injuries to prevent further damage. Communication is key when handing over a patient to the hospital. Provide a clear and concise report including mechanism of injury, assessment findings, vital signs, treatments provided. Accurate documentation is crucial for continuity of care and legal purposes.